All right, let's dive in. Today, we're tackling hydration and electrolytes.
Sounds refreshing.
We got a ton of medical texts, research papers, even some personal notes from you guys on this one.
Really dug deep into the archives for this one.
And honestly, getting prepped for this deep dive, I'm kind of blown away by just how much is going on inside us when it comes to plain old water.
It's way more dynamic than people think. It's not just drinking enough, it's this whole intricate system of fluids and electrolytes all working at the cellular level.
See, that's what gets me fascinated. One of the research papers mentioned we're basically like walking saltwater solution.
True, 50 to 70% water, the average adult. But here's the kicker. It's not just sloshing around freely.
Oh, I figured there'd be a catch.
It's organized into these compartments, intracellular and extracellular fluid, each with its own specific job and its own mix of electrolytes.
So, like, our bodies have little internal water parks, but with way more sciencey stuff going on.
Perfect analogy. Now, that intracellular fluid, the stuff inside your cells, that makes up about 2/3 of your total water.
Wow, so most of it's locked up in our cells.
Think of it like this. Each cell's a tiny watery balloon. And keeping the right balance in there, that's crucial for them to work, right?
Makes sense. Our cells are the building blocks. Gotta keep them hydrated.
Right. But then there's that other third, the extracellular fluid, hanging out outside your cells.
Where does that go? Just kind of between everything.
Well, it's in your blood vessels. That's the plasma. Then there's the fluid surrounding your cells and tissues. That's interstitial fluid. Oh, and specialized fluids, too, like cerebrospinal fluid.
Hold up, plasma. Is that different from just dot blood?
Ah, great point. Plasma is the liquid part of your blood. Mostly water, but also proteins, electrolytes, hormones, all sorts of stuff. It's like the delivery system, getting things around your body.
So even outside the cells, it's not just plain water, getting complex already. And all these fluids have different electrolytes.
Absolutely. Sodium, potassium, calcium, those are the big ones. Vital for fluid balance, your nerves firing, muscles contracting, the whole shebang.
Sounds like a delicate balancing act. And how does water even move between all these compartments? It's not just like a free-for-all, right?
Nope. Tightly controlled. One of the main ways it travels is osmosis.
Ooh, okay. I vaguely remember osmosis from school. Refresh my memory.
Basically, water moves across a membrane, like the one around your cells. Goes from where there's fewer dissolved substances to where there's more, trying to even things out.
So like if there's more electrolytes outside a cell, water will move out to dilute it.
Exactly. And vice versa.
Yeah.
Constant movement to keep things balanced for those cells.
Incredible. But we're always taking in and losing fluids. Sweat, pee, even breathing. How do we keep up?
Our bodies are amazing. We have regulatory systems, our kidneys, our thirst mechanisms, certain hormones.
So like internal sensors telling us what to do.
The kidneys, those are the stars. Super efficient filters, constantly cleaning your blood, figuring out how much water to keep, how much goes out as urine.
So tiny little water treatment plants inside us. That's kind of wild.
And thirst kicks in when we need more fluids. But as we age, that can get less reliable. So, got to pay attention to other signs too.
So it's more than just drinking when you're thirsty.
Yep. Age, your size, how active you are, the weather, even meds can affect how much you need.
This is way more intricate than I thought. You weren't kidding about the intricate dance thing.
Just getting started. We haven't even touched on what happens when those electrolytes get out of whack.
Okay, now I'm really curious. This deep dive is just getting interesting. Back again for more hydration adventures. Last time, we were getting into how our bodies keep this whole water and electrolyte thing balanced.
Right. But what happens when it goes wrong? That's where things get interesting.
Like a roller coaster at our internal water park.
Kinda. Electrolyte imbalances, they can happen for all sorts of reasons. And the effects, oh boy, they're all over the map.
Okay, let's break it down. We talked sodium, potassium, calcium being the big players. What about sodium? What happens when that's off?
Sodium's key for fluid balance, right?
Yeah.
Too high, that's hypernatremia. You get thirsty, tired, confused, severe cases, even seizures.
So too much sodium basically messes with how much water our body holds on to.
Exactly. Tries to compensate, could lead to high blood pressure, swelling. Not good.
And too little sodium, that was hyponatremia, right? What's that like?
Headaches, nausea, vomiting, even coma if it gets really bad.
Whoa, that escalated quickly. I was reading one of those research papers. Hyponatremia can be an issue for, like, marathon runners and stuff.
Oh, absolutely. Sweating a ton, you lose electrolytes, sodium being one. If you're only chugging water, not replacing those, trouble.
So it's not just how much we drink, but what's in it that matters.
Bingo.
Oh,
Especially when you're pushing your body hard.
okay, potassium's up next. What happens when that goes out of whack?
Potassium, that's muscle and nerve function central. Too low, that's hypokalemia. Muscle weakness, cramps, you're wiped out. Could even mess with your heart rhythm.
Heart rhythm, that's scary. What causes potassium to get that low?
Several things. Some meds can do it if you're sick and throwing up a lot, diarrhea, anything messing with your kidneys.
So not always something we can just fix by eating more bananas.
Sure, bananas, leafy greens, potatoes, those help. But got to watch out for underlying stuff too. Talk to your doc if you're worried.
Makes sense. And what about too much potassium?
That's hyperkalemia. Also not good for your heart. Really important to talk to your doc before you go popping potassium supplements, especially if you've got any kidney issues.
Got it. So both ways are bad.
Sure.
Sodium, potassium, those are vital, clearly. Now, calcium, what's its deal?
Everyone thinks strong bones, right? But it's way more than that. Muscles, nerves, even how your blood clots, calcium's involved.
Never knew it was so multi-talented. What happens if it gets out of balance?
Too low, hypocalcemia. Muscle cramps, spasms, get tingly sensations. Severe cases could even lead to seizures.
Wow, again with the wild range of effects. What makes calcium drop like that?
Vitamin D deficiency is a big one. Certain meds, hormone problems, anything affecting your parathyroid glands, those help regulate calcium in your blood.
It's like our bodies are these crazy complex machines, always trying to keep everything in check.
It is remarkable, and we're focusing on each electrolyte, but they all work together. Mess up one, throws off the others.
So how do we even know if something's off? Do we just randomly get blood tests all the time?
Listen to your body. Feeling unusually tired all the time. Muscle cramps that won't quit. Heart's doing weird stuff. Time to call your doctor, get those electrolytes checked.
So definitely not DIY diagnosis time.
Nope. This stuff's serious if left untreated. Better safe than sorry.
All right, electrolytes, check. But how does all this tie back into hydration? How do we make sure we're getting enough of both?
That's the million-dollar question.
Yeah.
And it's tricky because everyone's needs are different. How active you are, where you live, your health.
So that 8 glasses a day thing, that's a myth.
Guidelines are fine, but your body's the best guide. Thirsty, urine's dark, feeling wiped out, dry mouth. Those are your cues.
Makes sense. But how about electrolytes? Do we need to, track those precisely?
Honestly, for most folks, eating your fruits and veggies, getting enough protein, you're probably good. But if you're really sweating, working out hard, hot weather, maybe add some electrolyte drinks or foods.
So healthy diet, stay hydrated, that covers most of us.
Exactly. But like we said, certain situations, it gets tricky. Medical stuff, meds, intense exercise. Talk to your doc or a dietitian if you're unsure.
This deep dive is mind-blowing. Never realized how much goes into just staying hydrated.
It's a whole world down there at the cellular level. But knowing the basics, that's how we make smart choices for our health.
Welcome back to the deep dive. We've been exploring this whole world of hydration and electrolytes, and now we're going even deeper.
Deeper. Where else is there to go?
We're going microscopic. Gonna look at how different types of solutions, like what we drink, affect our cells directly.
Getting into the nitty-gritty. Like we've toured the whole water park, now we're checking out the individual rides, how they work.
Exactly. So we're talking isotonic, hypotonic, hypertonic solutions, right? I vaguely remember those terms from forever ago in school.
Don't worry, no pop quizzes here.
Yeah.
Basically, it's all about concentration.
Yeah.
How much stuff, like electrolytes, is dissolved in a solution compared to inside our cells.
And why does that matter to our cells?
Osmosis, remember. That's how water moves around, wants to even things out. So the type of solution outside a cell, that determines if water moves in, out, or stays put.
Okay, starting to come back to me now. So isotonic solutions, those are the dot neutral ones.
You got it. Same concentration inside and out. A cell's chilling in an isotonic solution. It's all happy, no big water movement.
Perfect balance achieved. Like Zen master cell.
Exactly.
Right.
Think of IV fluids, like normal saline,
Yeah.
that 0.9% stuff. It's isotonic, so it replenishes fluids without messing up the balance inside your cells.
Makes sense. Now, hypotonic, that's where things get interesting.
Hypotonic, that's fewer dissolved particles outside compared to in the cell. So what happens? Water rushes in. Got to dilute that higher concentration inside cell.
So the cell, it puffs up.
Puffs up, swells like a water balloon getting filled. Sometimes that's good if a cell's dehydrated, but too much too fast, that's trouble.
Okay, so hypotonic, it's a powerful tool, gotta be used carefully. And hypertonic, that's the opposite then.
Yep. Hypertonic, more concentrated outside. Water's got to move out of the cell to try and dilute things.
Cell gets all wrinkly and sad.
Kinda. Shrinks down, like letting air out of a balloon. Can be useful for certain medical things, but too much shrinkage, that's bad news too.
Wow, so just by changing the concentration outside, we can make cells do all sorts of stuff. It's like we're playing puppet master with osmosis.
And that's why it's crucial to understand this stuff, especially in healthcare. Giving the wrong type of IV solution, that could really mess a patient up.
This is incredible. We started with just drink water, and now we're controlling cells with microscopic solutions.
It all connects, right? From big picture hydration to what's happening inside each tiny cell, it's all about balance and understanding how it all works.
Couldn't have said it better myself. And honestly, after this deep dive, I'm feeling way more equipped to take care of my own hydration.
Me too. Knowledge is power, as they say.
Big thanks to everyone for joining us on this incredible journey into the world of hydration and electrolytes. Who knew water could be so fascinating?
It's the essence of life after all. Got to stay curious about it.